Hello everyone, this is Dr. Clark from the Center for Weight Loss Success, and this is video 2 on the potential health benefits on intermittent fasting. So a few videos here we're going to talk about intermittent fasting, something I've been toying with, and I'm very likely going to start trying to do this one day a week starting next month. So whether you want to call that for Lent or whatever. So let's talk a little bit more about intermittent fasting. Last video we talked about could it potentially help with weight loss. Now I want to hit on some of the things that potential other health benefits. And I say potential because there aren't a whole lot of studies out there on this stuff. And there probably never will be. And part of the reason is that it's very unlikely that they're going to do a human study on this, because we'll never get a group of humans to all kind of do an intermittent fasting for an extended period of time. And when I say extended period of time, we're talking about years and years and years, because there's probably only minimal benefit to this if we're only doing it for a short period of time. Because reality is life is what we do over the long term, not what we do day to day. It's kind of what we do over an extended period of time. So, but there are some very real potential health benefits to intermittent fasting. And one of those is cancer prevention. Okay, a number of different cancers, breast cancer, colon cancer, a number of very common cancers actually, they thrive by their energy sources being glucose. Okay, well, if we take that energy source away from the cancer cells themselves, they don't thrive so much. And what we tend to see is that in intermittent fasting, we talked about those acute stress effects and the beneficial acute stress effects to us, okay? But for a cancer cell that's growing like crazy, that acute stress may not actually work very well for them. And so it even more stresses the cancer cells. And by doing that, then they're less likely to thrive, and they're less likely to divide then. And that's what, the real problem with the cancer isn't that there's a cell, it's that it grows and potentially spreads to other places there. So if you actually slow that down, or you prevent it from happening, and I had mentioned earlier that many cancer cells actually, they thrive on glucose. And if we take that away, and our body then is utilizing fat as its energy source, or ketones, which come from fat, a lot of the cancer cells can't actually use ketones efficiently. So subsequently, then the cancers can't grow. And if the cancers can't grow, subsequently then they can die. And so it can actually help prevent cancers then. So if you actually kind of do this intermittently, or for those people who actually live in nutritional ketosis, which I've talked about in Losing Weight USA topics before, you may actually prevent cancer. But actually nutritional ketosis has been shown to be a cancer treatment. So there is some real potential benefit. Again, those studies will probably never be done. Kind of same thing with what I'll call longevity, basically anti-aging. Can we live an extended period of time if we do certain things? Okay, well, there's certain things that we do. If we avoid smoking, we avoid, other things, and we try to stay healthy, that hopefully will live longer. So intermittent fasting, could this actually be a potential benefit then? And yes, it could. Now, there have been animal studies. Again, human studies very likely won't be done. But there have been animal studies. And what we see with rodents, mice, rats specifically, when they're intermittently fasted, if they're only eating kind of intermittently, and for most of these studies, they would do every other day feedings on them. So typically I wouldn't recommend that for humans, but still the concept is very similar in that if they're fasted kind of every other day, even if the calories are kept the same, between two groups of mice, that we found is that the group that is fasted actually lives about 1.5 times longer, which, that's pretty remarkable. That's a significant difference. And again, it may be part of that acute stress versus chronic stress effect there. So there is probably we know there's benefit in animal studies. So whether that translates into humans or not, again, that's questionable. But okay, the concept is real there. And then finally, kind of the third thing, just one of potential health benefit, is what I'll call brain health. And, one of the things as we get older, what's the bad things about getting older? Well, if we lose our memory, okay, that's one of the worst things. We could walk around, we could be 100 years old, we can't remember anything, we don't, we're demented, and subsequently then I don't know if we've done ourselves or anyone else any favors there. So, how can intermittent fasting actually help with this or prevent this problem? Okay, what we find with intermittent fasting that there is an increase in something called brain-derived neurotrophic factor, or BDNF. And brain-derived neurotrophic factor is something that helps protect our brains. Okay, and it does help with regulating memory. It does help with just our overall how we think, or our cognition, okay, as well as then it helps with our learning. So if we can keep this BDNF elevated, and intermittent fasting helps elevate this, is that we tend to have healthier brains. Now, the other thing that intermittent fasting does is it makes our bodies utilize ketones more effectively. Ketones come from the breakdown of fat, and we know that ketones are neuroprotective. And so kind of if we can increase our utilization of ketones, and if our brain utilizes ketones better, there's that false assumption our brains require glucose. They do not. Okay? They thrive on ketones wonderfully. But the issue is that we typically give our brain glucose. But if we take the glucose away, there's an increase in ketones, and intermittently fasting actually increases the ketones that we can utilize. Ketones, again, come from the breakdown of fat, and they are actually neuroprotective. All right, so that's just a quick little video on other potential health benefits. Next time, I'm going to talk a little bit about kind of choosing a method of intermittent fasting. If you have comments, if you have questions, please post below. Thank you for listening, and thanks for sharing. We'll talk again soon. Take care.